Millions of seniors are doing something tonight that their own hearts are silently paying for. And the terrifying part is that most of them have no idea. They've slept this way for 30, 40, sometimes 50 years. It feels comfortable. It feels normal. But every single night, this one position is triggering a chain reaction inside the cardiovascular system that raises the risk of irregular heart rhythms, increases the likelihood of stroke, and quietly weakens the heart muscle over time. The position is sleeping flat on your back. And if that's you, please stay with me because what I'm about to share could genuinely change the trajectory of your health. I'm Dr. Sarah Mitchell, and this channel exists for one reason: to take the latest peer-reviewed research and translate it into real, actionable guidance specifically designed for adults over 60. If you haven't subscribed yet, do it now so you don't miss our next video. We cover what most doctors don't have time to tell you during a 15-minute appointment. Now let me explain exactly what happens inside your chest when you lie on your back, why seniors are uniquely vulnerable, and what position cardiologists are now recommending instead. Here is the core problem. When you lie flat on your back, the soft tissue at the back of your throat, your tongue, your soft palate, the tissue around your uvula, all of it loses muscle support and falls backward. In younger people, muscle tone keeps this tissue largely in place. After 60, those muscles have been steadily losing elasticity for years. The tissue collapses more easily. It partially or fully blocks the airway. And when that happens, oxygen levels in the blood begin to drop. Your brain detects the drop. It fires a distress signal. Your heart surges. Cortisol and adrenaline flood the system to force a restart of breathing. You probably don't remember any of this. You might not even fully wake up, but your heart just ran a sprint at 2 in the morning. And depending on how many times this happens per night, your heart runs dozens of those sprints every single night you sleep on your back. This is obstructive sleep apnea, and the numbers among seniors are staggering. The American Heart Association has found that between 30 and 80% of patients diagnosed with heart failure also have obstructive sleep apnea. That is not a rare condition. That is an epidemic hiding inside the bedroom. Comment below right now. Do you wake up feeling exhausted even after a full night of sleep? Comment. Always or sometimes, because your answer might reveal something important about what your heart is dealing with while you rest. Here is what makes the back position so specifically dangerous. Researchers at the Cleveland Clinic measured apnea events by sleep position and found that patients lying on their backs experienced up to 3 times more breathing interruptions per hour than patients sleeping on their sides. 3 times. Every one of those interruptions is a cardiovascular stress event. Every surge of adrenaline hardens the arterial walls just a little more. Over months and years, that accumulated stress translates into chronically elevated blood pressure, reduced heart efficiency, and structural changes to the cardiac muscle itself. A 2021 study published in the Journal of the American College of Cardiology followed adults over 65 and found that untreated sleep apnea, the type most common in back sleepers, was associated with an 82% higher risk of developing atrial fibrillation. Atrial fibrillation is an irregular heart rhythm that dramatically increases the probability of stroke and heart failure, 82% higher from sleep position. And here's what most people don't realize. You don't have to snore loudly for this to be happening to you. Silent sleep apnea affects a significant portion of seniors. No dramatic gasping, no sounds that wake a partner, just shallow, fragmented breathing that goes completely unnoticed, while the cardiovascular system slowly absorbs the damage. Margaret was 68 years old when she started noticing that her mornings felt wrong. She wasn't tired at bedtime. She slept 8 hours. But by 9 AM every morning, she was exhausted, foggy, and reaching for her second cup of coffee. Her blood pressure, which had been stable for years, was creeping upward. Her doctor added a second medication. Nobody connected it to sleep. Then her daughter watched her sleep one night and counted 11 distinct moments in 1 hour where her mother's breathing simply stopped. A sleep study confirmed moderate obstructive sleep apnea, 34 events per hour, almost every single one occurring when Margaret rolled onto her back. 8 weeks after implementing the positional changes you'll hear in a moment, her morning fatigue had largely resolved and her blood pressure had dropped enough that her physician reduced her medication. But apnea events are only part of the picture with back sleeping. There is a second mechanism, and this one affects seniors even without a formal sleep apnea diagnosis. When you lie flat, gravity redistributes fluid from your lower body toward your chest and head. During the day, that fluid sits in your legs. At night, lying horizontal, it migrates upward. For a heart that is working at full strength, this is manageable. But after 60, even mild subclinical cardiac inefficiency, the kind that never gets diagnosed because it hasn't triggered obvious symptoms yet, means the heart has to work harder to process that fluid shift. Fluid accumulates around the lungs. Breathing becomes slightly more labored. The heart pumps slightly less efficiently. You wake up without knowing why you feel off. Johns Hopkins researchers studying adults between 60 and 80 published findings in 2022 showing that consistent back sleepers had 34% higher markers of systemic cardiac inflammation compared to side sleepers. Cardiac inflammation is a direct precursor to arterial stiffness and reduced pumping function, 34% higher, simply from how the body is positioned overnight. This is why a growing number of cardiac surgeons now treat sleep position as a clinical risk factor, not a lifestyle preference. The research has made that case clear. So what is the right position? The short answer is your right side. Sleeping on the right lateral side keeps the airway tissues elevated and supported rather than falling backward. It reduces the frequency and severity of apnea events. It minimizes overnight fluid redistribution toward the heart and lungs, and the heart itself sits in a slightly more favorable mechanical orientation within the chest cavity, reducing the pressure load on the cardiac muscle. A 2020 study from the European Heart Journal followed over 2,800 cardiac patients across 3 years. Consistent right-side sleepers had 27% fewer hospitalizations for cardiac events compared to back sleepers. That is not a marginal difference. That is a meaningful, measurable, protective effect from a change that costs absolutely nothing. You may have heard that left-side sleeping is better for the heart. This is true for certain specific conditions, particularly severe acid reflux or gastroesophageal issues, where the left side reduces stomach acid backflow. But for cardiac health and seniors, and particularly those managing hypertension, early heart failure, or irregular rhythms, the right side is consistently favored by cardiologists. For a small subset of people with specific valve conditions, even right-side sleeping requires individual guidance from a physician. If you have an existing cardiac diagnosis, always confirm your optimal position with your cardiologist. For the general senior population, right-side sleeping is the evidence-backed choice. Now here's the question I hear every time this topic comes up. What if I cannot stay on my side? I move in my sleep. I always roll back onto my back by morning. This concern is completely legitimate, and there is a tested practical solution. A 2019 clinical trial in the journal Sleep Medicine tested what researchers called positional therapy, using physical barriers to prevent rolling onto the back during sleep. The result was a 74% reduction in the time participants spent sleeping supine. Not a clever gadget, not an expensive device, a barrier that prevented rolling. 74%. You can replicate this tonight with a full-length body pillow placed along your entire backside. Tuck the lower portion slightly under your hip. This creates enough gentle resistance that most people naturally stop rolling onto their back within a few nights. Some people prefer a firmly rolled blanket. Some use a positional shirt, a sleep shirt with a pocket sewn into the back, containing a firm object that makes lying flat uncomfortable. The specific body pillow technique from the Cleveland Clinic for seniors recommends a second pillow placed between the knees as well. This aligns the hips and spine, which is the primary reason people give up side sleeping within the first week. Hip discomfort. The knee pillow eliminates most of it. Your ear should be aligned with your shoulder, not elevated above it. A pillow that is too thick forces the neck upward and creates the kind of morning pain that makes you blame side sleeping when the real issue is pillow height. Here is your complete protocol tonight. Place a body pillow or firmly rolled blanket along your back to prevent rolling flat. Add a second pillow between your knees to eliminate hip pressure. Choose a primary pillow that keeps your neck level with your spine rather than propped upward. Commit to this arrangement for 4 full weeks before evaluating. Most people begin noticing changes: clearer mornings, lower resting heart rate, reduced morning headaches within the first 2 to 3 weeks. If you experience persistent morning headaches, wake regularly with a dry mouth, or feel unrefreshed after adequate sleep hours, please speak to your physician specifically about a sleep study. Sleep apnea is highly diagnosable and highly treatable, and a staggering number of seniors go undiagnosed for years because neither they nor their doctors ever connected the symptoms to sleep position. One final note: sleeping on your back is not the only risk factor your heart faces at night, but it may be the most correctable one. A pillow behind your back tonight costs nothing, and the cardiovascular protection that accumulates over weeks, months, and years of better sleep positioning is real and documented. Before you do anything else, share this video with one person in your life over 60. Someone who has mentioned feeling tired all the time, someone who snores, or someone managing blood pressure issues. A 30-second share could matter more than you realize. Tell me in the comments, what position do you normally sleep in? Back, right side, left side, or stomach? And if you are going to try the positional pillow method tonight, comment "trying tonight" so we can track who is making this change. I read these comments, and your responses help shape the topics I cover. If this video added value to your health knowledge, please subscribe so you don't miss next week's video. We are covering the single morning habit that cardiologists say dramatically reduces stroke risk in adults over 65, and it takes under 4 minutes. You will not want to miss that one. I'm Dr. Sarah Mitchell. Protect your heart, change your position tonight, and I will see you next.